Oh, maybe,
right.
maybe not.
It sounded like they were celebrating that.
Hafaday and good afternoon. Thank you for joining us today for our COVID-19 press conference. At this time, I would like to recognize the presence of our Honorable Magahaga, Governor Lulian Guerrero, as well as our Lieutenant Governor Joshua F. Tenorio. We also have with us in our Zoom room, Department of Public Health and Social Services Acting Director Art San Augustine. We have our Guam Memorial Hospital Administrator Lillian Perez Posadas. We also have with us our Public Health Containment and Isolation Lead, Chima Mbakwam, as well as our Guam International Airport Authority Deputy Executive Manager, Ricky Hernandez, joining us in our Zoom room. I now like to turn over to Governor Lulian Guerrero for her remarks.
Thank you, Crystal. Half a day. This pandemic has been our lives for the better part of the year. And I know that many of you are experiencing quarantine fatigue. This isn't unique to Guam. Across the nation, people are not staying home like they did in March and April. Because of a dramatic increase in Guam's number of confirmed cases and the growing hospitalization rate, I declared pandemic a condition of readiness 1 on August 14th and the stay-at-home order a week later. To prevent Guam from becoming an Italy or Spain, we knew we had to act quickly, and the magnitude of our response had to match the scale of the crisis we face. Truthfully, our case positivity rate is gradually on the decline. COVID hospitalization census is gradually decreasing. We know this extended isolation period has affected everyone, but there are additional needs that must be accommodated. Based on the available health and mobility data and guidance from the State Surgeon Cell, the PAG, and we are announcing the relaxation of some restrictions, recognizing that we must manage this virus as best we can, not simply let the virus manage us. Guam remains in PCORD 1, and we will be under a safer at home advisory. We still encourage everyone, especially vulnerable people, to stay at home and to limit their contact with people outside of their households. Because the data shows that some activities pose a greater risk of transmission than others, not every activity will be permitted right now. But my recovery panel of advisors and the physician advisory group are currently working on a timeline for the phased-in reopening of Guam. The data is being relaxed. The data is being reviewed constantly, and a number of options and safety protocols are being considered. Beginning tomorrow, September 25th at noon, the following restrictions will apply. Retail stores and personal care, such as hair, nails, tattoo shops, and pet grooming may operate at 25% capacity. Basic restrictions like 6 feet social distancing, wearing masks, and no congregating must be followed. For malls, all common areas will remain closed and no congregating will be allowed. In-restaurant dining is still prohibited, but outdoor dining will be allowed. Outdoor dining is restricted to those in the same household only with a maximum of 6 people, and there must be a minimum of 6 feet distance between each table. Solitary and non-contact sports and sport facilities such as firing ranges, individual water sports and water sports services, scuba diving, golf, and tennis will be permitted. No organized sporting events are allowed. General office work and other services may resume under certain restrictions. Face-to-face contact for businesses are by appointment only. No waiting rooms or congregating is allowed. However, we are highly encouraging teleworking as much as possible. Services at funeral homes remain at no more than 10 occupancy and limited to immediate family and single household units. All must maintain a customer listing to assist with public health and contact tracing efforts. All permitted businesses and activities must adhere to the Department of Health and Social Services guidance. We will also be implementing a change in our quarantine protocols. Effective noon on Saturday, September 26th, all incoming travelers will be quarantined at a Government of Guam facility. On day 6, they will be administered a test, and upon receiving a negative test result, they will be allowed to continue their quarantine at home. To the people of Guam, we need your help. None of us want an extended safer at home advisory. PCOR 1 cannot be a permanent state. PCOR 1 is not and will not be a permanent state. But in order for us to move to the next stage, everyone needs to do their part. We are each responsible for our own individual actions, and our individual actions directly impact what happens to us as a community. As we continue our response, I assure you that we are using whatever tools we have to flatten the curve. Earlier this month, we launched Guam COVID Alert, a smartphone application that notifies your phone if you may have been exposed to the coronavirus. This application was designed to help contain the spread of the virus as public activity increases. Guam COVID Alert is completely voluntary and, most importantly, completely anonymous. It does not collect your information or track your location, but in order for it to be successful, we need a lot of people to use it. According to researchers at Oxford University, for every 100 to 200 downloads of the application, it can prevent 100 infections and save 1 life. This Saturday, we are having a 2-hour download-a-thon starting at 6:30 p.m. on TV8, PBS Guam, and the KUAM News Facebook page, so you can learn more about the app while also being entertained. We need to remember that our new normal isn't normal at all. As restrictions are relaxed, we cannot be business as usual or life as we knew it. Gathering with friends and family who are not in your household is still not encouraged. Face masks, social distancing, and good personal hygiene still are the best tools we have to beat this COVID-19. Take precautions to slow the spread of the virus, or we risk a return to lockdown once more. Please stay home, wear your mask, social distance, and download Guam COVID Alert.
Thank you, Governor. Now to Lieutenant Governor Josh Tenorio.
Today, I just want to add.
Lieutenant Governor, please unmute.
Thank you, Crystal. Can you hear me? All right. I just want to briefly add to the remarks of the governor that we are heading back again into a very structured reopening, but please don't let your guard down. And I just want to point out that if you're looking at the news nationally, the rate of infection in the United States is rising again, which means there's going to be additional threats for infection coming in through people coming back to the island, many people that we love and care about. So the quarantine posture is there for a reason. Not only is it there to protect everybody on Guam, but it's there to protect everybody that is coming back. It's there to make sure that people get identified and tested so that to determine their status so that we can treat them accordingly, get them better and get them back and safe. And so I just want to briefly ask the people of Guam to continue their vigilance, to continue observing all of the safety precautions that we have outlined, and to continue to follow the public health advisories. Thank you.
Thank you, Lieutenant Governor. I'd now like to welcome our panel of speakers. If you can turn on your cameras. Again, we have with us in the Zoom room, Art St. Augustine from Public Health, as well as Chima Mbakwam, and we also have GMH Administrator Lillian Posadas. Now to our questions. From the Pacific News Center, May Habib.
Half a day, everybody. Half a day, Governor, Lieutenant Governor. I just want to be really clear. So the PCOR 1 status is extended, but you're not giving us a definite end date, and it's a gradual reopening.
Yes.
Okay, and you didn't really mention anything about parks and beaches. Will people be allowed to gather?
No, we still are closing parks and beaches.
Okay, and then I have a question. I'm not sure if it's better directed to public health, but in regards to the high test positivity rate, which is one of the factors that we look at in terms of having the island be ready for a complete reopening or more reopening, many of the tests that are being done right now are actually contact tracing, which means that there's a high probability that those people are in fact COVID positive because they've come in contact with somebody that's COVID positive. So is the high test positivity rate actually indicative of how many people have COVID or the community spread?
I'm sorry, Art, that may be directed towards public health.
Okay, I'm sorry. Where am I? Hello, can you hear me? Hi,
Yeah.
can you
Yes,
hear me?
Art.
Yeah. Hi, Chima. If I may ask, as our lead in the containment and surveillance, if you would please share your thoughts to the question raised of us this afternoon.
In respect to your question, Mayor, what we're doing is focused testing for close contacts. But at the same time, if you can see, last week or last 2 weeks, we had a community outreach for one of the villages. So we are going hand in hand, trying to balance out the more people at risk, which are the close contacts. But at the same time, we're doing the community testing to balance out community spread. So it is a continuous effort, and we're also increasing our testing capabilities. We're using the clinics now to also support public health. That's why our testing has expanded and is indicative of the fact that while the numbers are increasing and we are also testing more people, so it's a good balance for what we are trying to achieve, continue testing those at high risk and also balancing it out with the community.
Thank you, May. Nick Delgado from Hit Radio 100. Nick, I welcome you to ask your question.
Hi, can you hear me now?
Yes.
Hello, Chris. Okay. So, half a day, Governor, half a day, everyone else. So, with today's announcement, are we at a point where we're going to start seeing government agencies start to open up and operate? And how confident are you that these past 5 weeks of your stay-at-home order has been working?
Yes. Thank you, Nick. Government businesses will start coming back. And like I said, we are going to encourage more teleworking still, Nick. And if there are going to be any face-to-face business, it would be done only by appointment. And so we are still very careful as we gradually open these businesses. So the numbers that we are seeing, we are very, we're confident that we're starting to see gradual decrease and gradual decline. You know, our community spread was very exponentially increased. However, I feel that what we have done, what we have done is we have stopped our community spread to be in the triple digit. We are now in mid double digits. And unfortunately, our fatality rate continues to be about 1 a day. Very sad to our loved ones that have gone, and very sad message to our community. But we are also seeing at the hospital that the COVID census is gradually declining. We were at one time 60. Now I think we are at 31 or 32. And our ICU census is also starting to gradually decline. So although we are opening, and we are opening slowly and very cautiously, just like we did in the first round, we are also very diligent in monitoring our data and our science. And our economy recovery panel, our PAG, and our surgeon cell, and our legal people, we're all working very closely to monitor this on a daily basis and proceed accordingly. So I just wanted to say, add this also, Nick, that the most, I think, effective part is the mask, wearing the mask. And of course, staying home as much as we can and not being out there if we don't have to be out there.
Nick, your second question.
All right, thank you, Governor. And so, as we've seen in recent days, the Superior Court of Guam judge has been releasing passengers from the quarantine facility. And even to today's hearing, Judge Iriarty said public health isn't doing their job and letting passengers simply know of their due process rights, or that they have the right to object to going to quarantine. Aside from today's changes to those quarantine procedures, I wanted to get your take on that.
Right. So since the first decision that was made, the judge did say that we needed to improve in making sure that the travelers and the people that are being quarantined need to know their due process and what other options and choices they have. And since then, I know that public health has been complying to the order of the judge, and that we are now giving them the necessary documents and the necessary instructions and the necessary information for them to decide and to make a better choice, or a choice of what they would like to do with those information. So we have been doing that since we have been ordered, and I think it's been a week. So we are complying to the orders of the judge.
Thank
And
you.
I
Nick.
don't know if Art wants to chime in for any more information, but that's my knowledge and information.
Actually, Governor, you covered it quite well. The passengers are presented the request to voluntarily quarantine at the government facility. And if there is any indication that the traveler is not comfortable with that in the processing at the airport, as the governor indicated, they will then be offered the notice of involuntary quarantine, which will also include the issuance of Article 6 and its definitions, as well as the documentation of a temporary directive for quarantine. Having said all that, they will then proceed on to our quarantine facility. And so that is a process right now. There is a script that our processors are using to offer the inbound travelers, as the governor indicated, the request of their support and their cooperation in our fight against COVID-19 to voluntarily quarantine so that we protect not just themselves, but our family and our friends here in Guam. And again, as the governor indicated, there is the option for involuntary quarantine, and that notice is then processed at the airport. Thank you.
I also wanted to add, Nick, that in her decision, she also noted the importance of being quarantined.
Thank you, Nick.
Thank you.
Nestor Lacanto, the link.
Thanks, Crystal. Good afternoon, everyone. Governor, as you probably know, businesses have been crying out for help. Is there something that you and the government of Guam can do to help them, and what would that be?
You know, of course, there has always been the federal aid that has come down from anywhere from PPP loans. I think those are still taken advantage of the businesses. And of course, we had our small business grant that we have using our coronavirus funds. And Gita is looking at other options that we might have to help out our businesses. Additionally, I know the PUA and the FPUG money are also still being distributed out there. And we just recently did the lost wage compensation program, and that helps the individuals unemployed. And so those are some of the things that are still going on in our community to help out our unemployed and, of course, our businesses.
But I think they argue that you're basically forcing them to remain closed. So all of that PUA money and all the other federal assistance money, they can't benefit from that because they won't have any customers. And in fact, some say that because they're closed, local residents are buying stuff off island, and that money is leaving. How do you respond to that?
I'm pretty sure that that is happening. And I'm also very confident that my work in collaboration with our economic recovery panel, who are representatives from business industries and representatives from associations of businesses, we are working very diligently together to open up as much as we can and as much as how we are comfortable in doing so, to also balance opening up and increasing activities, and doing so at a very low risk situation, and doing so to continue safeguarding the health and the safety of our community. And it's been really good working. And that's how we have come up with some of these activities that we are now reopening, Nestor. The other thing is, it's really a very complicated and very fragile situation to be in, because I certainly recognize the plight of the small businesses. I certainly recognize that our economic health is also being affected significantly. I also recognize that this virus has killed 38 of our people, something that is, I think, a lot given our per capita. And so when you're looking at it, you mentioned about me forcing the businesses to be closed. When you look at it, Nestor, you know, I have to weigh at what, weigh a balance and make sure that my decisions are being made for priorities of the circumstances at that point in time. And the circumstances at that point in time was that we had an exponential surge. We had over 150, I think at one time, of positive cases. And then we started seeing more people going into the hospital. People we know, family members we know, and we're very afraid about what course that they would take down that path. So as governor, I have to weigh all of that. And the circumstances at that time, my priority was to do something real urgently, real quick to stop the spread. I sometimes wonder what it would be if we didn't. I would think we would be 200, 300, and even more in terms of positive cases a day. So, you know, I mean, that's not going to be seen because we came in there and stopped it right away. But I certainly am I'm very sensitive to the health of our economy and to the health of our people and the balance that has to come forward to protect both the health of our people and to start bringing back our economy, because of course our people's livelihood is just as important as their physical and mental health. So it's a very fragile place to be. It's a very complicated place to be, but I think what we have done has been the right decisions and the right actions at the time.
Thank you, Nestor. Peter Santos, KUAM.
Afternoon, Gov. Thank you very much for having me. So I just wanted to start off by saying the 4 triggers that move us from PCOR to PCOR are a downward trend in positive cases, yet our positivity rate is still high. Also being able to treat all hospitalizations, the numbers have decreased, but the deaths have increased, you know, and being able to conduct mass testing, and public health must have the capacity to conduct adequate contact tracing. Do you feel that we've met all these triggers well enough to justify the easing of these restrictions that you've said here today? Do you think the people of Guam will be safe?
I do. If the people of Guam and the businesses would adhere to the public health guidance, I think we are. And I think we're going to start seeing more decrease and gradual decline of our positivity rate. And also, as far as testing, we have the capacity for the testing. We have the human resources for the testing. As far as the contact tracing is also has been fortified. And we now are going to be doing SARA Alert, which is another application that would monitor those people in quarantine. Much more so in an automated way, so it can alert also our people to prioritize and to focus on the much more needed attention for contact tracing. And of course, the COVID alert. These are tools that are going to help us with the contact tracing. It'll help us with the surveillance. And I'm very happy that these tools are now launched because this would help us with the contact tracing and the surveillance. And that's very important as we now start allowing people to quarantine at home and so forth. So we've got the tools in place to help us contain and to help us decrease the positivity rate and the new cases, and to help us prevent people from being exposed and to prevent people from being infected, so that we prevent them from hospitalization and further prevent them from death and to save their lives. So the things that we have in place, Peter, I'm very, it's help that we have gotten in comparison to what we did in the first time around. We have more information about the virus. We have more resources to deal with it. And I just, in that given situation, the biggest tool is the compliance of our people. And the biggest tool and the most effective impact is the individual responsibility to protect themselves, protect their families, and protect their communities. And it's very simple. Wear a mask, wash your hands, social distance.
Thank you for that, Gov. I have another question. I was just told that there's a protest scheduled actually at 4:30 today at Adelup, you know, pretty much right on your front lawn, asking that you end the lockdown in general and open up all businesses, amongst other things. Knowing that several businesses have had to close for good, and many of them are actually at their tipping points, trying to survive, some even going as far as taking legal action. What is your message to these local businesses who are pretty much waiting to see if there's a plan on how they're going to proceed and move forward?
Right. So like I said, you know, I have, I understand exactly what their issues are. I am very sensitive to it. I work very closely with the business people to get their advice and their guidance on how best to open back our businesses and how best to open back our economy and how best to do it with the focus and the priority of health and protection and safety of our community. So I'm not aware about the protests. We are starting to open businesses. We are starting from the very low risk activities, and gradually we will get there. This is what we did the last time, and it worked. So yes, we are starting to open businesses back up, but I am not going to be irresponsible and open everything at once, because that to me is not the prudent way. That to me is not the safe way. The safe way is to gradually open them, see how people respond, see how people behave, see how people act. And if we continue to see decreases in our numbers, then that's a good thing. And I'm very appreciative that our people are complying. Believe me, I do not want to stay in this state. I don't. I do not. I said it. We cannot be in PCOR 1 permanently. That is not our life. But I do know that we have to accept that this coronavirus is going to be part of our life until the vaccines come out. And how best can we handle this coronavirus and still protect our people and still open our businesses? That's the key.
Thank you, Peter. Mariana's Business Journal, Rianne Pareto.
Hello, good afternoon, everyone. Good afternoon, Governor, Lieutenant Governor, everyone. I kind of want to kind of piggyback off of your response to Peter about, you know, gradually reopening the businesses, Governor. My first question would be, with the gradual reopening of businesses in various industries, how is it decided which businesses are determined to reopen, albeit at limited capacity? Like, how is it determined that they're low risk or
Right.
more so higher risk?
Right. So it comes from the work and research of my economic recovery business group, and also from the physicians advisory group, also comes from our surgeon cell, and also comes from our legal people, and also comes from public health, who are the experts of this whole pandemic crisis. And so we looked at what's risky, what's less risky, what's more risky, what's high, based on the information and science from other places that have done the research. Not all of these information or the scientific information is applicable to us here, but we take it and we make it applicable to us in some adjustments and in some realignment of the factors that determine the risk, like, you know, a frequency of like, for example, frequency of traffic in a business, or the volume that's in there, or the type of business that's there. Is there more contact? Do they stay longer? Do they require that your mask not be worn to do the business? You know, things like that. And they came up with, these are the low risk areas, and then these are the medium risk, and these are the high risk. And so we looked at the low risk, and the business community also said, when we open them, we should not open them completely. We should put limits and conditions on it so that we can, again, monitor and safely and gradually open to the point where we feel that risk of exposure and transmission is minimized. So that's basically how it came about. And, you know, then we decided from their advice and their recommendations of which of those now to open initially. And then maybe in the next week or two, we will continue on based on what our data and numbers are.
Okay, thank you, Governor. My second question would be, you mentioned that there are medium risk and high risk classifications of businesses and activities, and has that been decided on or discussed of examples of medium and high risk?
Sure. For example, a low risk would be golfing, because it doesn't require, it's not a contact sport. It doesn't require, you know, congregation. You could golf in a partner, or I think, I'm not a golfer, but I think the highest team is 4. And they distance, they're social distancing. You know, one card is further away than the other card. So that's considered a low risk. A high risk in the sports would be your contact sports, you know, your soccer, your football, your basketball. These are high risk contact sports. And you can verify that just from what's happening in the mainland with you know, with football teams and basketball teams and games that are being canceled because the players are positive, and not just one, sometimes 30 of the players. So that's how we look at it. In terms of restaurant, we looked at, you know, takeout is low risk. Outside dining is low risk, because there's science that says if you are in an open space, the virus, your chances of transmitting and also being infected is lower if you are outside and not in a confined area with ventilation that may just circulate the air. So those are some of the examples. And so we decided to do outside dining, and we decided to allow golf.
Thank you, Rianne.
That's the thinking that was, that's the thinking around it.
Pacific Daily News, Jojo Santa Tomas.
Buenas. I'm wondering about our capabilities in two areas. One is contact tracing. At what point are we able to complete the trace list for a confirmed positive with the fortified staff you have now? And the other for the hospital, how well are we able to match the incoming hospital patients with available beds?
Okay, so Jojo, for contact tracing, Annette and Chima probably has more information also, but my understanding for contact tracing is we're probably going to have about 60 to 80 people that will be doing or are already doing contact tracing. We just had a team out of, I think it's UC San Francisco, that came out and did a 3-day contact tracing seminar. And from there, we were able to train about 96 people. So that's a resource. That's a pool that we could get to for contact tracing. I also understand that when you are tested and you're positive, that the contact tracing begins immediately and people are called right away. So additionally, if we use the SARA alert and if we use the COVID alert, these are apps that would help also with the contact tracing. So I'm very confident in the system and the infrastructure and the program of our contact tracing from public health. The hospital, you know, the nurses are starting to be fatigued. Pretty expected. We did ask through FEMA and through the military for a medical assignment, and we got 15 nurses and some respiratory therapists, and we got some doctors, and they're here for 30 days to help out. Additionally, because we know that this is a short-term solution, in order for us to bring a much more permanent staff number, we contracted with a vendor called New West, which is being used throughout the United States. And this is a traveling healthcare professional recruitment and company that provides staffing. And so we, I think, got 33 nurses just 2 days ago. And they are nurses for the emergency room. They are nurses for the ICU. They are nurses for the telemetry. They are nurses for medical surgical. And these are nurses that are trained to deal with COVID patients. Additionally, we have a partnership with GRMC. And what we're doing is we are decompressing GMH. We are sending non-COVID patients over to GRMC. And we are also sending staff over to GRMC, and that would allow us more space, and it will allow us the capability to be able to take care of more COVID patients if that is the case. Additionally, I think what we're also doing is providing the skilled nursing facility for also overflow of COVID cases. So we have the space, and we are now beefing up our staffing, which is working, and we can get more from this New West. They told us if we wanted 50 nurses, they can give us 50 nurses in 2 or 3 days. So that's what we're doing to build up our capacity for the hospital. And so in that situation, I feel that we are at a better place than we were in March or April. And the capacity of the hospital is much, much more increased in terms of being able to take care of more COVID patients. Also, just want you to know that we have 79 ventilators, and those ventilators are available. They're in our warehouse. They can be used right away. Right now, out of, I think, our 13 ICU patients, we have 9 on the ventilator. So we're able to do it in terms of personnel now, in terms of facility space, and in terms of equipment.
Thank you. My second question, I'd like to direct to the Chief Public Health Officer. Sir, you spoke about a timeline of activities and businesses that would be able to open. Can you tell me what's way down at the bottom of the list? Is it, as the federal doctors have said, gyms and bars and restaurants, or in-dining restaurants, or is there something else that's way at the bottom?
Are you asking for the Chief Public Health Officer, or are you asking?
You, sir.
Oh, okay. Okay, me, sir. Yeah, the list actually is maintained right now by our economic team, and gyms are on the list for consideration. But what we're doing right now is we're looking at how things occur with this new relaxation of PCOR 1, and based on the data and our behavior as a community will then be our indicator as to if we're able to move forward to start opening up other businesses and activities. And that's where we're at this time.
So Jojo, can I just add to that also? Remember, I don't remember if it's the reporter before you that asked me about how do we determine what's high risk or low risk?
Yes.
But bars are definitely very high risk. And that's also, I think, validated when we did our contact tracing, that a number of our positive cases were as a result from social gatherings in the bars. So bars is very high risk. Anything that requires social gathering is considered moderate to high risk. Yeah. Dine-in restaurants are considered also risky, but I have to say this, that the restaurant industry has done a tremendous, amazing job in providing Department of Public Health and Social Services with the guidelines that they themselves have developed, their infection control guidelines, to help protect their employees and to help protect their customers. And so, you know, if you are a high risk, but you've put in mitigation efforts and mitigation programs and mitigation activities, then you're diminishing that high risk so that we would be still okay to open them. Maybe not the very last ones to open. I don't expect that to happen. But the higher your risk and the more mitigation efforts you have, you are decreasing that risk. And so it's just safe for everybody all around, employees, customers, the community, your family, your friends, yourself.
Thank you, Jojo.
Can I just add on that part of the mitigation also is reduced occupancy rates. And so I would just add that that's part of the considerations from both the public health and from the business perspective, is that these industries or activities that are medium to high risk, some of that mitigation can be with lower occupancy rates. And those lower occupancy rates tied to some of the metric that we're tracking, such as the hospital admissions, the positivity rate, and the other factors that have been looked at for moving in and out of PCOR areas. I also wanted to add on that nobody wants to go back into a lockdown. So one of the considerations in the future, if we have problems, situations, and I mentioned earlier that rate of infection is increasing again in the United States, which means a big risk for us given the large number of people that are traveling into Guam. Looking and determining whether or not modifying occupancy rates can also be used as a response in that case. So I just wanted to add that on, Jojo. Thank you.
Thank you.
Thank you. Lanny Walker from the Guam Daily Post.
Good afternoon, Governor.
Good afternoon.
You spoke about a phased-in plan being worked on. When do you anticipate that being completed, and when will it be shared with the community?
Phased in plan, you mean going from PCOR 1 to PCOR 2 and also lifting? I don't remember saying a phased in plan, but can you remind me? Is it from going from PCOR 1 to PCOR 2?
Will you be? Yes, a plan to gradually reopen. When do you think that would be complete, and when would it be shared with the community?
Oh, when would our plan, you mean? Okay, so right now, our plan has been completed in terms of lifting restrictions. But the plan may change, but we do have a plan on lifting. And, you know, if we went to PCOR 2, this is what we'll do. If we go to PCOR 3, this is what we'll do. So what basically it is businesses that we are already opening now in PCOR 1. For example, the restaurant, right? But we're saying it's 25% occupancy. So that maybe when we go to PCOR 2, it might be 50% occupancy. And then when we go to PCOR 3, it may be, you know, 75% or maybe totally opened. So that's the phased in plan that you are probably referring to. And so, you know, I'm looking at like a month from now, hopefully that we will be more in PCOR 2, and hopefully that we are increasing the opening capacity of these restaurants. Again, that is guided by the data that we are very aware of.
Just to add, Lanny, that right now, of course, the governor has authorized outdoor dining, and she continued to authorize takeout, but nothing. But I think she's being very open-minded as we see results to give progress and perhaps in occupancy rates for those industries, even within the PCORs that we are in. And I just wanted to add that clearly with, you know, additional cases in the 40s right now, there's still, and given the fact that we're so remote, we have longstanding resource issues on this island. And given the hospital capacity, you know, this PCOR 1 is a reflection of the hazard that we have right now, given those measures. And I just want to reemphasize to the public that we are still in a serious state. And although, as the governor said, we have some progress, but in such a small community that enjoys social gatherings, that in culture we have social obligations that involve, especially with funerals, social gatherings, it has become a liability for our island and for our population. And this PCOR 1 situation reflects that we truly are not out of the woods, but we are looking at the data and the science to try and get us further down this path on the new normal that we're all living in.
Thank you, Lieutenant Governor and Governor. For my second question, BBMR has noted in its latest revenue report that there is an increase in revenues of nearly $30 million. Is that maybe a funding source that could be used to help the business community, particularly the small businesses that are in need of help?
What information are you referring to, Lanny? 30 million? I don't know about that.
Okay, is there an increase?
When you say increase in revenues, are you talking about revenues collected beyond our budgeted revenues? Is that what you're talking about?
Yes, Governor. Could any of that be used to help small businesses?
Well, you know, helping small businesses, like I said, we do have our coronavirus fund that's available, and the Guam Economic Development Authority is working on a plan and some options that we can use. The revenues that we've collected that are beyond the budgeted revenues cannot be used unless it's appropriated by the legislature. I cannot just take those monies and use them. It has to be appropriated. It has to give me the authority to do that.
Thank you, Lanny. Last but not least, from the Pacific Island Times, Ethan.
Thank you and good afternoon. I heard this question was asked already, but I want to reword it specifically for the businesses. Who will be allowed to open next? Do you have specifically just the list of businesses and who's going to be allowed to open with the different phases? And where will we be able to look at this information? Because I feel like a lot of people are holding their breath right now, and it's causing a lot of agitation. And just this one small piece of information would help a lot.
Yes, absolutely. You know, that is something that we can publicize and we can share with the media. I think in the past we have, but some of the businesses that we are looking at is, of course, the gym is something that we are looking at. We are looking at possibly dine-in restaurants. We're looking at possibly childcare centers. Let's see, gyms, childcare centers. Most businesses we are already allowing to open. All the retail businesses are allowed to open at a 25% occupancy. What other business? I think those
I think, Ethan, when the executive order is issued, there will be attached public health guidance. And the public health guidance, if you've been noticing, has very specific descriptions of the type of businesses that are going to be authorized to open and the parameters in which they will be open.
Okay.
So I totally understand what you're saying about, you know, the businesses' anxiety because they don't know if they are going to be open or they're not going to be open. And and like I said, I think we have published those in the past, but there's no reason why we are not going to do it. We will, like we have.
Okay. Thank you. I don't have any further questions today.
Okay.
Thank you. That does it for the question and answer round. Just going to give the mic over to Governor Lilian Guerrero and Lieutenant Governor Josh Tenorio, if they have any closing remarks.
Thank you. And thank you for the panel that are here today. And also thank you for the questions that you have. And we'll certainly continue working with the media to push out the information and to give some sense of peace with our business people. I also wanted to say that we're working with the Chamber of Commerce and we're working with the Guam Women's Chamber of Commerce, excuse me, and we're working with other business industries and we are communicating very closely with them. And so we are pushing out information in that sense. But certainly we will push it out via the media. And just wanted to thank you, the media, for, excuse me, for giving information to our people because it's important. It's important that our people are informed, and we are going to continue informing our people through social media, through press conferences like this, through executive orders, through public health guidelines, through websites and so forth. I also would like to again emphasize that We have to, I think, understand that this virus is going to be around for a while, and we have to adjust to living with this virus. And at the same time, while we are adjusting to living with this virus, the basic tenet and the basic principle behind this, I think, is that we have to also behave in a way that we are protecting each other from transmission. And we are protecting our loved ones from getting sick. And we are protecting our loved ones in preventing them some serious illness and complications. And this virus is a virus that we continue to take very seriously. And I have to say, our people have, for the most part, taken it very seriously. And for those that are compliant and those that adhere to the directives and to the science of mitigation, I thank you very deeply, and I appreciate your sacrifices, your struggles. I appreciate your patience. I appreciate your commitment. For those that don't, I only hope that you just look next to you and look at your loved ones, and that they are the priority in maybe changing your behavior so that we can continue to protect your loved ones, to protect yourself, and to protect our communities. So again, as a government, we have and we are taking this seriously. As a government, it is our responsibility to do the best in the interest of the public, to protect and safeguard our community and our island in every way we can. And as a government, we are going to continue providing the services that our people need to remain healthy, to remain safe, and to have some peace of mind in the quality of life that they have. So thank you so much for everything that you have done, and will continue to fight this god-awful virus.
Lieutenant Governor, did you have anything to add?
Yeah, I just wanted to continue to send our thoughts and prayers to all of the family members and the colleagues and friends that have been left behind by each of the 38 victims of COVID on our island. And unfortunately, we are going to have more. There are many sick people on Guam. And I want to appeal to those folks that have tested positive and we're very lucky to be asymptomatic or to have mild symptoms. Many times this could be seen as a false sense of security, but I can tell you that the possibility for folks, especially in the younger age brackets, to spread this to more susceptible members of the society or to anybody. There are some people that have no comorbidities that are having struggles with the virus. We just don't know why, unfortunately. But it is something that can give a false sense of security, but even worse, some people become indifferent. They don't believe that we should be taking these drastic measures to protect people. Some people are suggesting that we adopt a posture of herd mentality, where everybody should get infected, so we can get past this part of the pandemic. That will result in a wide number of people that will die on this island. And so please, I just want to ask those folks, and for people that have not been affected, to not be indifferent. It is causing many problems. I also want to thank the business owners for their sacrifice. And really, obviously, that doesn't mean as much to them than the dollars that should be flowing into their pocketbooks or to their businesses if we were living in a normal state, but it just isn't the case. And we'll do everything we can to try and help and to provide aid. But more importantly, or most importantly, I want to thank the frontliners that are continuing this fight. And over the last few weeks, we've been introduced to frontliners, nurses at the hospital, who have been in the forefront, who have been the ones to substitute for family members alongside those COVID patients that have died. And I just want to say thank you. Your sacrifice is not being forgotten. We appreciate what you're doing. And although you are working in a very unsafe environment because the nature of this disease, this virus it's highly contagious. The hospital is a safe place. They're doing safe precautions, but this is a very, very highly infectious virus. And so each day, the nurses, the doctors, the firemen, the policemen, people in the private clinics, and those that are transporting them, the patient careers, all of them. I would just want to say thank you for a great job that you're doing. And we continue to pledge to provide you all the resources and assistance that we can. So thank you very much.
Thank you, Lieutenant Governor. An executive order and the accompanying public health guidance for the lifting of restrictions is forthcoming, and a copy of the governor's remarks will be posted on her Facebook page. Thank you, everyone, for joining us, and please stay safe.